The government deemed public activity restrictions, or PPKM Level 4, has been successful in reducing COVID-19 active cases. In July, Jakarta saw more than 12,000 cases, but the numbers has dropped to 1,400 as of August 10.
That's right, Russia. And one of the marks of reduced cases in Jakarta is declining bed occupancy, or BOR, at Wisma Atlet COVID-19 Emergency Hospital in Kemayoran. And for the latest development at the hospital, we are now connected live with the head of hospital Secretariat, Colonel Dr. RM Tjahja Nurrobi. Good morning. Thank you for joining us, Colonel. Colonel Nurrobi, right now, bed occupancy rate at Wisma Atlet is supposedly at 25%. Can you give us an elaboration on that development?
Yes, thank you. Before I will explain that the Wisma Atlet is actually the biggest COVID-19 hospital, probably in South Asia region, because there is no COVID hospital in this region. Since the end of June, we have seen a decrease in cases at the Wisma Atlet until now. It has reached the bed occupancy at 21.26% this morning, are as many as 1,678 patients from all 7,894 bed capacities. This condition actually is in line with the decrease of cases in Jakarta and national as well.
That's great news.
Yes, so how many patients are still under treatment there in the Wisma Atlet? And on average, how many patients are admitted per day in August?
Currently, there are around 1,736 patients being treated at the Wisma Atlet. And in August, there are about 200 until right now down into 150 patients a day from Jakarta and also from vicinities areas of Jakarta.
That is great news to hear about the patients, but we're also interested to know about the health workers. Colonel, how are the condition of the health workers right now? Does this mean that there's less strain on the people working at the Wisma Atlet as opposed to the time when it was obviously at more higher capacity?
Currently, there are approximately 3,000 medical and non-medical personnel working at the Wisma Atlet. Of those numbers, approximately 2,500 are health workers, consist of military and non-military medical personnel. Right now, they are all in good condition, and the most important thing is to keep them working in one big team with spirit, of course.
Right.
Since the number of patients has decreased, health workers have been divided into 6 shifting teams. Previously, there were 5 teams. They will rotate it every day, where one team will be dedicated as a vaccinator in the Jakarta area, so that before August 17, the herd immunity is achieved in Jakarta.
Oh, that's great news to hear indeed, hopefully. Now also, can you tell us about the 120 health workers that have been seconded to another cities?
Okay, let me explain first. The health workers who work at the Wisma Atlet consist of military and non-military personnel. The Wisma Atlet, which is led by the TNI Surgeon General, is directly under the control of the TNI Commander-in-Chief. When the TNI CIC needs to deploy of medical personnel, he can mobilize military personnel in the Wisma Atlet as well. In this situation, TNI CIC received information about an increasing cases in several areas such as Kalimantan, Central Java, and Yogyakarta. So we should deploy the TNI medical personnel to those areas as soon as possible. So right now we are already deployed 14 personnel to Kalimantan, 40 personnel to Central Java, and 120 personnel to Yogyakarta. They are actually young medical officers and cadets who is being trained in the military academy in Magelang.
Wow, these young heroes really working hard in order to keep us safe and healthy. Now, speaking of staying safe and healthy, we also heard that health workers will start receiving, some of them will start receiving a third vaccine or a booster. What is the progress on that so far, Colonel?
In Wisma Atlet, since early of this month, the third vaccine as booster has been administered to the health workers. Right now, there were about 500 health workers have been shot. Hopefully, in about 1 until 2 weeks, we can vaccinate all health workers in Wisma Atlet.
Now, Colonel, we actually wanted to also know more about yourself. During the peak surge last July, how long have you been unable to go home?
Yeah, sometimes we should stay at Wisma Atlet due to the situation we have to manage. That's depend on situation. Actually, as management, I have to go to several locations in one day, such as Cilangkap TNI headquarters, and some vaccination locations. And sometimes I have to stay several days in Wisma Atlet.
Wow, that is certainly can be. I
dedication.
can imagine how tiring that can be. So, what's your secret, Colonel? Because obviously you seem healthy, you look great. What is the secret to stay fit despite having to work long hours sometimes, having to be there
exposed
overtime,
to-
as well as being around generally patients with COVID-19?
First of all, I should show to all health workers there a discipline in implementing health protocols. As a head of secretary, I should look fit every day to pumping their spirit. Otherwise, they will get bored, and that's a big problem. Being happy is the most important because that will be the immune booster for you against COVID. Besides, of course, doing a healthy life such as consume healthy food, supplements, sport activity, and good quality of rest. Maybe the quantity is not good for me, but I try to manage the quality as good as possible.
Quality over quantity. Colonel, one last thing before I let you go. You mentioned it twice already in regards to how important it is for the mood to be boosted, how, to feel happy. What is the general mood like around Wisma Atlet now that it's not as high capacity as it is before? Everything seems to be more under control. Generally, amongst the patients and the health workers and yourself, what is the mood currently like?
Yes, as I told you before, that right now the situation is under control. The health workers in good spirit and the mood as well. He has a good capacity, good mood, and hopefully after 1 and 2 months we can fight again, and the level of the COVID-19 in Jakarta area will be decreased, hopefully.
Hopefully as well. We wish nothing but the best for everyone there, including yourself. Colonel, thank you so much for your time this morning. We truly do
Yep.
appreciate everything that you and your team are doing out there. Stay safe. We hope to talk to you again very
Thank
soon.
you so much, Colonel. Stay
Have
safe.
a great day, Colonel Nurrobi.